You're listening to The Mary Jones Show on the Talk of Connecticut.
And we're talking about football. We're talking about concussions for young people, whether it be youth, teens, speaking with sports medicine and family medicine physician. He's board certified in sports medicine, and he is with Bristol Hospital, Dr. Martin Canillas. Doctor, again, thank you so much for joining us.
No problem, no problem.
You mentioned helmets. Have football helmets changed a lot? And in your experience, in terms of what you see, in terms of people coming into your hospital, should they be changed even more? Are they doing the trick?
Well, what I'm telling you is, there's all the companies, the manufacturing companies are putting a lot of research, in trying to get the best or the most protective helmet as possible, in all categories, like NFL, college level, even high school, or even little kids. So definitely there is actually in North Carolina a big facility just doing research about that. So
really?
Yeah.
Mm-hmm. And what is the treatment for the most part? Let's just say an 11-year-old boy comes in who has a concussion. What's the treatment for that patient, doctor?
Yeah, well, what we call is like the brain rest. First of all, we identify a true concussion, which is different than just a minor, head trauma, head concussion. It has to be some disturbance in the neurological function or a mental state. And we pretty much say, brain rest. That means no TV, no cell phone, iPads, or texting, or not even lights or noises that can interfere with the recovery process. The brain cells have to, they have to heal, and there's a process for that. So it's okay, for 1 to 2 days to do that, and then they can slowly resume their activities. But we do have a protocol, in order to return to play. It's pretty much all the, high schools and college level, they kind of follow this like 5-step protocol in order to, go back and play competitive. It basically just means that, you start with some light, cardio, and then you kind of go a step up on a little bit more intense, and then you do some, more heavy, but non-contact, and then you transition to practice, and then finally to competitive level, But that should be in days, no more than one stage in 1 day.
Is there such a thing, doctor, as a minor concussion and a major concussion, or are there just concussions?
No, definitely there is. We have some sort of test or questionnaire that we do, and we can do it clinically, or even with imaging, and kind of say this one is a minor one, this one is a severe one, depending on the severity and how they respond. We have like tools that we do. There's a questionnaire test that we call SCAT for there's a SCAT-3 that's for children from 5 to 12. That most of the school, I don't know if most of them, but some schools actually they do it before season. And that gives you a kind of a number with a baseline where they are. So that's a very good, very helpful tool that you can do like 20 minutes after a head concussion. You reassess and you kind of compare the numbers just to see how severe it is, the impairment, if there is any. But yeah, definitely there are many grades of concussions from like mild to, severe.
Mm. And do you often, in addition to the resting the brain and the activities, obviously, for the young person, does medication come into play in terms of treatment?
Well, it's mainly supportive. If there's a headache, you do medication for headaches. If there's like a nausea, you do medication for nausea. But there's no just a medication for concussions. Mainly just is we let the body to heal on its own, with time. Time is our best friend when it comes for concussions, yeah.
Oh, Dr. Martin Canillas, sports medicine and family medicine physician with Bristol Hospital, former professional basketball player from Paraguay. That's very, very cool. I do want to mention the wonderful programs and departments and specialists that you have over at Bristol Hospital. I know also a little different subject, doctor, but I know you're having a free discussion this coming Monday on joint health.
Yeah, that's right. That's right. Dr. Rubins, Dr. David Rubins is is the head of our department. He's doing a talk, in joint health. So everybody's welcome to come and, and give us some input also about, Bristol Hospital is doing an amazing job, in this ortho and sports line, that we're building. So we are, very happy with everything pretty much.
Oh, absolutely. And that's this coming Monday. It's free, 6:30 to 7:30 at Bristol Hospital. I know the website is bristolhospital.org. And for that particular event, if you are interested in going, if you can go, give them a call, 860-584-8306. Dr. Martin Canillas, the sports medicine. So yes or no answer, doctor. Do you think that we should stop football for kids?
My personal opinion, no. I mean, I'm just going to say education. That's the take-home message. Education. First of all, the kids, they need to speak up. They shouldn't hide any symptoms. That's very important. That they want to play, but they have to say, if anything is bothering them. And then education about the coaches and the parents, that's the key here.
Makes all the sense in the world. Dr. Martin Canillas, thank you so much for joining us. Appreciate your expertise.
Thank you.
Have a great weekend. Professional basketball player goes to become a physician. We'll be right back. This is Mary Jones.
This is the Talk of Connecticut, WDRC AM and WDRC FM.